Hello all you healthy blood pressure warriors. My name is Ingrid and I want to welcome you to the healthybloodpressure.com channel. Having high blood pressure is nothing to take lightly. This is because high blood pressure can lead to serious conditions. These include heart attacks, stroke, and kidney failure, and they can be life-threatening. This is why doctors often use medications to keep blood pressure under control. Along with the regular blood pressure lowering medications, some researchers are also looking at the benefits of aspirin. Aspirin is an over-the-counter drug which many people take to reduce pain. But is aspirin okay to take to reduce high blood pressure too? Let's look at the research on this topic, and then we'll discuss who can benefit from aspirin and some of its risks. In 2005, a group of researchers in Spain carried out a study on taking aspirin at night. The study consisted of 328 patients who had untreated hypertension. The researchers divided them into three groups. The first group took a special diet only. The second group took the diet and also 100 milligrams of aspirin every morning. The third group had the diet and 100 milligrams of aspirin every night before bedtime. After 3 months, the researchers once again measured their blood pressure over 48 hours. In the first group, blood pressure came down by about 0.2 units. In the second group, blood pressure rose by about 2.6 over 1.6 units. But in the third group, the scientists noticed a significant drop in blood pressure by about 6.8 over 4.6 units. The study concluded that low-dose aspirin at bedtime could provide a valuable approach in helping to control mild hypertension. In 2017, scientists from Portugal did another study on using aspirin along with blood pressure-lowering medications. They evaluated multiple studies on both humans and animals. Some studies showed that aspirin by itself might not reduce blood pressure, but when combined with other blood pressure-lowering medications, they could offer more protection. This is because of their ability to improve the reactions of blood vessels to inflammation. According to some of these studies, aspirin works well to protect the heart when taken with angiotensin receptor blockers. This is a drug that doctors commonly prescribe to treat hypertension. Your doctor may advise you to take aspirin if you've already had a heart attack or stroke. This may prevent another future heart attack or stroke. They may also suggest aspirin if you have a high risk of heart disease. The risk should be high enough to consider aspirin as a solution, even though it has side effects. For high blood pressure, you might take aspirin at bedtime if you have pre-hypertension or very mild hypertension. If you have very high blood pressure, taking aspirin may at times increase it further. So follow your doctor's advice to know whether aspirin would help or put your blood pressure at risk. Another group of people who can benefit from aspirin consists of pregnant women with preeclampsia. Preeclampsia is a condition where pregnant women develop high blood pressure even though they may have previously had normal blood pressure. In such women, low-dose aspirin could help avoid the danger of high blood pressure during pregnancy. The main side effect of aspirin is that it's also a blood thinner. Too much aspirin in your blood can prevent it from clotting. If your blood does not clot, it may cause internal bleeding. This usually happens in your gastrointestinal system, including your stomach and intestines. So people with bleeding issues should avoid aspirin. Aspirin may also cause stomach ulcers. This can disturb the way your stomach produces acid, and this leads to heartburn, indigestion, and other gastrointestinal conditions. In addition, aspirin could raise blood pressure in those who've had high blood pressure for a long time. In summary, aspirin may help in some cases when combined with other blood pressure lowering medications, and it may help lower blood pressure when taken at bedtime instead of after waking up, but the research is still limited. Plus, too much aspirin increases the risk of internal bleeding. Aspirin alone shouldn't be the drug you take for reducing your blood pressure. It's not the primary treatment for high blood pressure. Always consult your doctor first before taking any aspirin. It may be inexpensive and easily available, but it doesn't suit everyone. If you have high blood pressure already, in some cases it may make it worse. If your doctor prescribes you aspirin, follow the dosage exactly. Low-dose aspirin may be beneficial for those with high blood pressure, but higher dosages have multiple risks. Along with following the right prescription, always maintain a healthy lifestyle. Proper diet, exercise, and reduction of stress can go a long way in managing your high blood pressure. If you'd like to incorporate healthy and delicious foods into your daily eating, get our 101 Blood Pressure Lowering Foods ebook. As you probably already know, the number one way to lower your blood pressure is to eat healthy. That's why we researched and wrote an ebook called 101 Foods to Lower Your Blood Pressure. This ebook contains all kinds of foods that are scientifically proven to lower your blood pressure, and we'd like to give it to you for free. Just go to healthybloodpressure.com and download it today. Thank you for watching and have an amazing day.